Hi, I'm Kairia. This is my partner Modi.
Hi, I'm Modi. Today we will present something which is important, especially for women. You can see the title, Characterization of Breast Cancer, Interstitial Fluids by TMT Labeling, and LTQ Orbitrap Mass Spectrometry, and Pathways Analysis. So, and you can see the authors here and the journal. So now let's start with the introduction. The first of all, with what is cancer? Cancer is currently considering as the endpoint of numerous genomic and epigenomic mutation, and as the result of the interaction of transformed cell within the stroma microenvironment. So the present work focus on breast cancer, one of the most common disease affecting the female population in industrialized countries. So you can see that in 2008, 3 million of new cases and 1.7 million of deaths. So just in Europe, among this new cases breast cancer, approximately 28% of all cancer, with 40% of patients, which is they have lymph nodes positive to disease. And the tumor tissue is complex, but it's possible to see two main components to analysis, which is the different cell types and the tumor microenvironment. So the interstitial space is part of that microenvironment and considering as the connective and supportive tissues of the body. And the interstitial space can be divided into parts, interstitial fluids, and structural parts of the extracellular matrix. Tumor interstitial fluids are characterized by the presence of high hydrogen and carbon dioxide and lactic acid and low of glucose due to tumor metabolism and protein. Nowadays, there are many types of screening. Only mammography, which has a high sensitivity and precision, is widely accepted method for early detection of breast cancer. However, at present, we need to provide more reliable diagnosis to improve patients' response to therapy and to identify new drug. So the proteomic analysis of interstitial fluids may represent an attractive source of biomarker, and study of fluids derived from associate which show only late in stage cancer kind of proteins, which kind of protein can including as the growth factor. So now let's move to the aims and objective. So there's two in this work yields two main nova, which is from the methodological side and from the biological side. From the methodological side, the development of combined experimental and computational approach to other analysis in breast cancer, interstitial fluids, and primary cell, and on the by using based on quantum and mass spectrometry. And on the biological side, many different signaling pathways have been found active, strongly linked to the vision and metastasis and development and proliferation, and this is finding can be used as useful source of information to understand carcinogenesis mechanism. So now let's move to experimental and procedure. So majority of reagents and chemical used in this experiment were obtained from demo significant and sigma aldrich. So sample collection, 3 patients not briefly treated with chemotherapy breast cancer based on the lesion and tissues. On the table, you can see here 2 different of diagnosis, which is invasive ductal carcinoma and fluids tumor. So the ductal carcinoma have a high effective in female population, while the fluids tumor is very uncommon types to the female population. The authors choose to analyze this is cancer types because of the impact on the population and different in origin of the cancer. So sample preparation, interstitial fluids and primary cell were extracted from the patients having the different cancer type from both healthy and tumor. The sample were transported in PBS for the treatments. So now we still in experimental procedure. So TMT labeling, all samples were treated with LC and trypsin enzyme to ensure a double digestion. So the TMT reagents were used according to the manufacturer instruction and mixed with the sample before immunoDBIT analysis. So immunoDBIT analysis, each pool of labeled sample were subjected to immunoDBIT analysis according to literature. So because the blood has a high amount of albumin and hemoglobin, so the reduced can fraction technique to separate out some compounds to make analysis more easier. So data analysis, database searching, there is so for searching for the protein identification, and the statistical evaluation was done by using ANOVA and Benjamin, and pathway analysis were performed using cytoscape. So validation of proteomic data by Western blotting. So once the mass spectrometric data was analyzed, some protein were selected for Western blotting, where first the sample were run on SDC air gel, and then the gel was transformed into nitrocellulase membrane to incubate with primary and secondary antibodies for detection. The considering protein. So now we will move to my partner.
The first result about volcano blot. Due to a lot of presence of albumin and immunoglobulins in blood, the research did the MUD-PIT fraction step to get rid of these proteins. On comparing healthy data with cancer data, a volcano blot was generated for each sample type, that is the flood and the primary cells for patient 1 with respect with patient 3. The y-axis is the logarithm 10 or p-value, and the x-axis is the logarithm 2 or fold change value, and these were calculated on ANOVA and Benjamin tests. The researchers observed in flood in patient 1 were 399 proteins and 564 proteins in patient 3, and the primary cells was 116 modulated proteins in patient 1 and 336 in patient 3. The different colors represent the difference in the p-value and fold change value obtained from the sample data. The comparison between the sample type showed that 11 proteins were common between the flood and the primary cells. To investigate the proteins further, the list of modulated proteins were imported into cytoscape to derive the functional networks. Figure 2a on the left indicates the functional network of a flood from patient 1, and 2b on the right indicated primary cells from patient 1. For both the figures, red cycle represents upregulated proteins in pathological samples, and the green circle represents upregulated proteins in healthy samples. There were differences in size of nodes as well, which were made proportional to the fold change of the modulated protein. It should also be noted that the flood pathway is much more complicated when compared to the primary cells. This slide depicts the same as before, but for patient 3. Figure 3a on the left indicates the functional network of a flood from patient 3, and 2b on the right indicates the primary cells from patient 3. In figure 4 was prepared using the cytoscape analysis, where the modulated proteins from both the flood and the primary cells for each patient 1 and 3 were clubbed into specific groups with similar functions. The final step of the work consisted in the experimental validation of mass spectrometry data using a Western blot. So 5 proteins were identified by mass spectrometry from the flows from both patient 1 and 3 and were analyzed on Western blot. The comparison was made between the healthy and pathological sample taken for patient 1 and 3, and the difference in band indicated the difference in protein quantification between the healthy and tumoral of the patients. The conclusion is this paper as the combination of mass spectrometry with biostatistical analysis was exploited to compare the fluid and primary cells between two patients having breast cancer with different diagnoses. The fluid is a source of valuable information, and the research proved that this is a better sample to study rather than the primary cells from tumor. In light of results obtained from these experiments, the methodological approach suggests in this study presents an accurate and reliable method to identify proteins from pathway analysis. In this slide, we're showing our critical analysis to this paper. First, the impact factor on this journal as per 2017 is 3.9, which is okay. Second, the author mentioned the healthy counterpart of tumor, which wasn't clear whether healthy cells were taken from the tumor or other present without any tumor. Third, there were some figures in the supplementary which make more sense to be in the main paper. The fourth criticism is that there were a lot of data which could have been incorporated in the paper but was not shown. Finally, the author selected 5 proteins to the Western blotting, but there were no discussion or explanation given for this choice.
This is the references. So thank you for your listening. Any questions?